A lot of people have arm pain, tingling, or numbness, or combination of that. Sometimes it's in the shoulder more. It goes down the arm, up to the fingers. It could be, either right or left arms, both of them. There's a number of conditions that can cause it. And obviously, I recommend, of course, to see a good chiropractor to evaluate you and to find out the exact diagnosis. But I want to talk just to educate you, to tell you about what are the different causes, what can cause it, and the potential areas that is contributing to the problems. Okay, and then either in this video or I'll make another video, I'll show you how to do some exercises. uh, there's actually stretches and strengthening exercises. Now, one of the most common, of course, cause of the tingling and numbness and pain in the arm is disc herniation. A lot of people have disc herniation or bulges, and it can come from trauma, or it can be from chronic. It could be, a gradual, or it could be acute. It can happen from specific injury or just stress, and muscles, when they weaken, they compress on it, and it can cause it lack of exercise and not being in good physical fitness. So this herniation is definitely a cause, and there's a specific treatment. Now, a lot of people rush into surgery and all of that. I don't recommend people seek surgery unless the nerve is in jeopardy and there's damage to it, and there's specific tests for that they do. Like we call it NCV, nerve conduction study, or EMG, electromyogram, to see if there's any damage that needs to be addressed right away. So that way, more urgent intervention is needed. But most of the people, that's not the case. And I tell people, just do, rest it, ice it, relax it, until let the body settle down, and then find out what's the cause. So again, getting back to the causes of it, there's a muscle in the front. In addition to that, we said the disc herniation. But let's say you do an MRI, or your doctor does X-rays and MRI, and they say, I can't see anything, and I don't know why you're having the symptoms, or maybe it's psychological, maybe it's stress. Sometimes that's thrown at you, and I say, well, there's something called encroachment syndrome, encroachment from different areas. There's three common areas that I see in my practice. Having been a chiropractor for 34 years, I've seen a bunch of these, and they come all the time. These are very common. There's a muscle in the front of the neck. It's called the scalenus muscle. And people think of muscles only in the back, and they get massage in the back. But there's actually these muscles in the front here. They're deep, and it's hard to really palpate them, and you can't really go and massage them. They're very delicate. There's a specific technique. Only the experienced ones know how to get to them and relax them. But the scalenus muscle, there's something called the anterior and middle scalenus, okay? And between these two muscles, okay, the nerve bundle, the brachial plexus, which is really the nerves and the blood vessels and the nerves, they all join together and they travel this way. So having tightness in these muscles, or if these muscles become inflamed, then they compress on those nerves, and it can cause symptoms in the shoulder, in the arm, up to the fingers, okay? It could, if it's the right side, it will be the right side. If the left, it would be the left. Okay, if both are involved, both arms could be involved. So that's a possibility to look into. And there's specific stretches, exercises for that. I'll show you either in this video or in a different video. Now, another common cause for tingling or numbness or pain in your arm or shoulder is compression from the back of the neck, actually the upper back area, which would be in here by the levator scapula muscle and the upper trapezius right here. This is a common area. A lot of people have stiffness. And so it passes, the brachial plexus passes through this area. So that can stiffen up, and sometimes it can be inflamed, and it can compress on nerves and produce symptoms. It could be locally right in that area, or it can radiate out, or a combination of both. And so that's another area to look into. And there's a specific, again, exercises, how to stretch and to strengthen the trapezius levator scapula muscles, which is involved in this area. Another muscle is called the infraspinatus muscle, which is the back of the scapula, okay? And the nerve passes through that. I don't know if, actually, I'm gonna show you right here. So the scalenus, I told you they're in the front, but then the second one I mentioned, between the levator scapular and the upper trapezius is around here, which is kind of considered upper back area on the base of the neck. And the third one, I mentioned the infraspinatus, which is back here, behind the shoulder by the scapula bone, okay? So those are the three areas that are very common that can cause compression syndrome. It can compress on a nerve and cause all types of symptoms. It could be from simple tingling to numbness to pain, and it couldn't radiate anywhere, upper or lower. And so, the what I wanted to bring across is that there is something you could do about that, and you don't have to suffer and keep popping medication, which you're just putting a band-aid over a band-aid, and eventually it'll stop to work, and then of course all the toxicity that would long term. If it is of course inflamed and you need to manage it, of course put ice on it, calm it down. If it's purely stiff muscles without any pain in that area, moist heat would do good. Or if it's a combination of both, you can alternate. Sometimes put hot compresses, sometimes put cold compresses. If it's not, if it's like tight and maybe a little bit of soreness, so you can do maybe 15-20 minutes of ice on it, and then an hour later, 2 hours later, you can put heat for 20 minutes. Then hour and a half to 2 hours later, you can alternate between heat and ice. That's for like what we call subacute. If it's like tightness, mostly tightness, but there's some soreness, that means there's some inflammation. But if it's very, very tender to touch and any movement, you don't want to put heat on it. You want to put purely ice, and you do 20-minute sessions, and you repeat it 3, 4, 5 times a day. You do it every hour, 20 minutes, 2 hours off, 20 minutes on, like that. Okay. And so these are very common causes for it. Now, I want to also recommend that if you have access to a chiropractor in your area, it's a good idea to have them look at you, evaluate you, and so that way there's like certain therapies they could do: use a muscle stem, use ultrasound, work on it manually to, if there's any scar tissue, break up scar tissue. Sometimes the spine also gets fixated, gets stiff, and doesn't move, or it could be twisted and stuck. Maybe you stepped wrong or worked very hard, you tweaked your body. So then they can adjust it, what we call spinal manipulation or adjustment, that will restore the mobility of the spine, assuming, of course, there's no contraindication. Now, if you're a little older and you have maybe osteoporosis, osteopenia, weakening of the bones, obviously we don't do spinal manipulation. We do very gentle, maybe immobilization. We work on the soft tissue, try to break scar tissue. So there's, based on the age and based on the problem, there's different protocols. But I just wanted to make sure that you understand that not all symptoms in the arm necessarily come from a disc herniation, that they can come from the what we call thoracic outlet syndrome, which is the scalenus muscle, and then I mentioned the trapezius and the levator scapular area complex. They can compress on it, and then the infraspinatus. I hope this video is helpful. I will make another video because I don't want to make this video too long, and I will show how to do these exercises for these all different muscles that could be potentially causing pain in your arm, and I hope this is helpful for you. If you are confused or if you have any questions, feel free to go on the comments, and I'll be happy to answer your question, or maybe create another video and elaborate a little bit more. And